Renal failure disease, commonly known as kidney failure, is a serious medical condition in which the kidneys lose their ability to perform essential functions needed to maintain health. The kidneys are vital organs responsible for filtering waste products, excess fluids, and toxins from the blood, regulating electrolytes, maintaining acid, base balance, and producing hormones that control blood pressure, red blood cell production, and bone health. When kidney function declines significantly, harmful substances accumulate in the body, leading to widespread health problems. Normal function of the kidneys. Healthy kidneys filter about 120 to 150 liters of blood each day through millions of tiny units called nephrons. These nephrons remove waste products such as urea and creatinine, while retaining essential substances like proteins and electrolytes. The kidneys also regulate water balance, maintain stable blood pressure through the renin, angiotensin system, activate vitamin D for strong bones, and produce erythropoietin, a hormone that stimulates red blood cell formation. Renal failure disrupts all of these processes. Types of renal failure. Renal failure is broadly classified into two main types: acute renal failure and chronic renal failure. Acute renal failure, also known as acute kidney injury, AKI, occurs suddenly over hours or days. It is often reversible if treated promptly. Chronic renal failure, or chronic kidney disease, CKD, develops slowly over months or years and is usually irreversible. CKD can progress through stages, ultimately leading to end-stage renal disease, ESRD, where kidney function is severely reduced. Causes of acute renal failure. Acute renal failure may result from conditions that reduce blood flow to the kidneys, directly damage kidney tissue, or block urine flow. Common causes include severe dehydration, blood loss, shock, infections, heart failure, and certain medications such as nonsteroidal anti-inflammatory drugs, NSAIDs, and antibiotics. Direct kidney damage may occur due to toxins, severe infections, or autoimmune diseases. Urinary tract obstruction from kidney stones, tumors, or enlarged prostate can also cause acute renal failure. Causes of chronic renal failure. Chronic renal failure is most commonly caused by long-term diseases that gradually damage the kidneys. Diabetes mellitus is the leading cause, as high blood sugar damages blood vessels in the kidneys. Hypertension, high blood pressure, is another major cause, as it puts continuous strain on kidney blood vessels. Other causes include chronic glomerulonephritis, polycystic kidney disease, repeated kidney infections, autoimmune disorders, and prolonged use of nephrotoxic drugs. Signs and symptoms. The symptoms of renal failure vary depending on its severity and speed of onset. In early stages, especially in chronic renal failure, symptoms may be mild or absent. As the condition worsens, common symptoms include fatigue, swelling of the face, hands, and legs due to fluid retention, decreased urine output, nausea, vomiting, loss of appetite, shortness of breath, and confusion. Advanced renal failure may lead to anemia, bone weakness, heart problems, and electrolyte imbalances such as high potassium levels, which can be life-threatening. Diagnosis of renal failure. Renal failure is diagnosed through a combination of clinical evaluation, laboratory tests, and imaging studies. Blood tests measure levels of creatinine, urea, and electrolytes to assess kidney function. The glomerular filtration rate, GFR, is a key indicator used to determine the stage of kidney disease. Urine tests help detect protein, blood, or abnormalities in urine output. Imaging techniques such as ultrasound or CT scans may be used to evaluate kidney size, structure, and possible obstructions. Treatment and management. Treatment of renal failure depends on its type and cause. Acute renal failure requires prompt treatment of the underlying cause, such as restoring fluids, treating infections, or stopping harmful medications. Chronic renal failure management focuses on slowing disease progression and controlling symptoms. This includes controlling blood sugar and blood pressure, dietary modifications, and medications to manage anemia and bone disease. In advanced stages, renal replacement therapy such as dialysis or kidney transplantation becomes necessary. Prevention and lifestyle measures. Preventing renal failure involves managing risk factors and maintaining kidney health. Regular monitoring of blood pressure and blood sugar, staying well hydrated, avoiding unnecessary use of harmful medications, maintaining a healthy diet, and exercising regularly can reduce the risk. Early detection through routine health checkups is crucial, especially for individuals with diabetes, hypertension, or a family history of kidney disease. Conclusion. Renal failure disease is a major global health concern that significantly affects quality of life and survival. Understanding its causes, symptoms, and treatment options is essential for early detection and effective management. With timely medical care, lifestyle modifications, and appropriate treatment, the progression of renal failure can be slowed, improving outcomes and enhancing the lives of affected individuals.